Okay, good morning, everybody. Hope everybody's having a kind of warm day today. It's a little gray and cloudy here in the greater Kalamazoo area, but welcome and thank you for taking the time to meet with us this morning. We know your time is very valuable. And originally this was planned to be in person, which we really thought it was going to be in person, and cannot blame COVID this time. It was not COVID's fault. We are renovating our office. And so the office renovations, just like everything else in the world right now, is taking a little bit longer than what we had hoped for. And so we are getting started and moving it to a webinar. So we're all used to doing that now. But I'm Susan Culhane. I'm with Nulty Insurance, and we thank you so much again for participating. We have 3 people that are joining us from HealthBridge, and it's Val Kramer, Leslie Quist, and Dean Ferris, and they're going to be managing the chat. Leslie will be managing the chat. So we encourage you guys to ask us questions. We don't even think this will take a whole hour unless you have a lot of questions. And if you do, that's wonderful. We're here to help you with this. But I was introduced, our whole team was introduced to HealthBridge a few years ago. Actually, 2019 is when they brought it to our attention, and we were just thinking, my goodness sakes, what in the world is this great benefit? Is it too good to be true? And we really talked about it, learned a lot more. Val has just been wonderful educating us on this product, and I'm telling you, it truly is a win-win-win, not only for you as the employer to offer this great benefit when we all know we're in this labor shortage, when we're looking at benefits that we can offer that for recruiting and retaining employees. It's so important that we are always on the brink of offering something new. And so then COVID happened, and it took a while for everything to get back up and going, but HealthBridge is on the ground, and they just started with Bronson, and it was last summer actually, and you actually are going to hear some testimonials of clients that are using it, and one of them is Bronson. And so I think you're going to enjoy those testimonials, but I'm going to just go through this agenda. We're going to, obviously I'm doing my opening. We're going to have the customer testimonials, challenges for employers, why HealthBridge is such a great solution to offer for your to your employees, the value, and how to get started, another testimonial, and then really what next steps are. So Val, take it away.
Thank you so much, Susan. We really appreciate it. And as Susan said, if you do have questions, please feel free to put them either in the Q&A or the chat, and Leslie will be managing those as we go along. We're going to play that first testimonial, and then I'll do an opening.
Hi there, my name is Tina Sutherland. I'm the HR Director at Peckham. We are based in Lansing, and we just partnered with HealthBridge to roll out this incredible product to our employees in January of 2022. We have a pretty unique and challenging population. We are a vocational rehabilitation organization, so it was a challenge to explain what this product was, not only to our general staff, but to our employees who have different cognitive and English as a second language as barriers to understanding what the product is. However, Leslie and Valerie were phenomenal in their willingness to do whatever it takes to roll this program out, to be available, to answer questions and explain in any way possible how this program would benefit each and every person on our health plans. They attended in-person meetings at all of our locations, as well as conducted virtual lunch and learns. They put together communication materials and just made themselves available at all times whenever there were questions, for either from myself or from our employees. I would love to tell you more about this from my perspective. It was just a seamless rollout. They were really, really easy to work with, and feel free to reach out to me at any time, and I'm more than happy to share more of my experience or answer any questions you might have. Good luck to you.
So, we often talk about HealthBridge, and it is a new benefit, very innovative, as Susan talked about. And really, our partnership with Nulty has been an amazing one. When you think about it, Nulty being a leader in the community there, introduced us 2 years ago to their customers. And helped us. We're actually servicing just under 20,000 members in the Kalamazoo area, and much ado to Nulty for bringing us in, for educating people even before we were there in Kalamazoo. So we're really excited to be there, and these testimonials, I think, will give you a sense of the stories that we hear, like this one here from a Nulty customer, KSS Enterprises. Renee was so excited when Leslie and I went out to do the educational sessions with the employees. I thought she was going to jump up and down. She nearly did, and said, I have been waiting for this benefit, waiting to give this to you employees for 2 years, and now we're finally at the table. And so for her, as you can see, not only having these informational meetings, but having information that she can use with each and every one of her new hires all along the way, and hearing the great feedback that this program is doing what it's intended to do. So really appreciate the partnership. And again, as Susan said, I'm here with Dean Ferris. He's our Chief Growth Officer at HealthBridge, and Leslie Quist is our account manager. So you're in good hands all along the way with your HealthBridge team. So did you know that there is a new way to protect your employees financially, to reduce care avoidance and improve presenteeism? When you look at this new innovative benefit, we help to remove any financial barrier for your employees, and that helps lower their stress level, right? You can't pick up a trade journal today and not see statistics about stress. And Leslie and I see it every day when we're doing employee informational meetings. Folks will come up to us and thank us so much for bringing this benefit, because now they know, whether they're a single parent and wanting to be able to get the care they need when they need it, to a high earning person who says, you know what, this is a great benefit for me too, because now I can manage my household expenses in a different way and take advantage of the savings that HealthBridge gives to me. We all know that when people don't get the care they need when they need it, it's going to cost more money and the health outcomes are reduced. So with HealthBridge, we help people stay healthier, and they have the card, they're carrying it, so they know they have the benefit up front. Improving presenteeism, again, you're out there trying to keep your good employees and attract new, right? HealthBridge can be one of those unique benefits that can help you with that. And with that lowering of stress on a financial basis and medical costs, you're improving the presenteeism. People are there, they're at work, they can focus on what they need to in their day. So how do we do it? What is this financial security program that HealthBridge is bringing to the market? Again, we talk about that stress. So we hear every day of people, maybe they did go in for the initial care, but when they got to that registration desk at the provider's office and the provider said, okay, that'll be $252.60. How are you going to take care of that today? Their stress level just went up. They didn't know how they were going to take care of it. And so they avoided going back for their follow-up care. We heard the story of a woman who had eye surgery, and never went back for her follow-up care because she didn't know how she was going to pay for it. That's tragic. You work hard to provide benefits for your employees. And so we want your benefits to be the highest value they can be. 76% of employees say that they're stressed and that they would be attracted to an employer that they knew cared about them financially. HealthBridge is, again, one of those benefits that can help with that. So let's talk about what HealthBridge is. Again, we're new in the market, but we've been in West Michigan for 4 years. So new to the Kalamazoo market, but we have been in market for 4 years. It's a first of its kind financial security benefit. We help members manage their out-of-pocket costs, and that's co-pays, co-insurance, and deductibles for medical services only today, not vision, dental, but medical services. We complement your health plan that you have in place today. We don't take it over. So we always like to say, pull out your card, not your cash. When you have services, you're going to pull out that health card, health insurance card, and the HealthBridge card. It's simple, it's guaranteed issue, so non-discriminatory. Everyone that's enrolled in the current health plan with your employees, they all are enrolled in HealthBridge automatically. There's no credit applications, there's no enrollment forms, and your employees don't have any type of premium or fees in this program. So let's talk about our HealthBridge network, because one of the keys and why we couldn't bring this to the Nulty customers is because we didn't have a provider network there in Kalamazoo. You can see today we have over 4,800 providers in our network, and Bronson obviously is the anchor system there in Kalamazoo that's working with us today. If you have a situation where you are doctoring outside of the HealthBridge network, it's just business as usual. The HealthBridge program won't kick in. But whenever you see a Bronson provider and enroll an employed physician and provider practice with Bronson, this benefit automatically kicks in. And you can see we're in Dickinson County, way up in the UP there. We're also with Mercy in Grand Rapids and in Muskegon. North Ottawa Community Hospital in Grand Haven was our first hospital to jump on board with us. And we have also added Sparrow in Lansing recently. University of Michigan Health West is formerly located in Grand Rapids, formerly known as Metro Health. So those are our participating providers today. We also have a physical therapy group that's the 7th largest in the nation and will continue growing. So you can see on the map here, we are in talks underway right now to also expand to the Southeast Michigan market. So let's talk about the day in the life of a HealthBridge member. How does this benefit work? Well, again, it starts when one of our members has care at a HealthBridge provider that's in our network. They're not going to pay for any co-pays, co-insurance, or deductibles at the time they have their service. HealthBridge is then going to consolidate all claims in the last 30 days. So one of the reasons why people have a hard time paying for their health care is because they don't understand what they're paying. They get 4 different claims multiple times, sometimes weeks and months in between, and they think they've already paid it. I just had that situation a year ago. Wait a minute, I already paid that big one. They're like, no, that was the facility. Now you got to pay this one. Oh, okay. Well, HealthBridge consolidates all the claims in the last 30 days from our network providers. And so it's a really easy to read statement for our members. We also include the logo of our partnership companies. So that way, our members clearly understand, this is that benefit that my employer gave me, that I remember them talking about at the annual enrollment. And then we work with our members. So we provide consumer-friendly terms. Our members receive a 10% discount whenever they pay a statement in full. They get 24 months to pay each claim. So when someone pays the statement up front, maybe in that first month, because they've got money set aside, that's great. They get the 10% discount on the largest balance. But there are many that need time to pay. They need that extra time. So whether it's 6 months later or 24 months later, whenever they pay that statement in full, they'll receive a 10% discount on that balance at the time they pay it off. And we interact with our members in many different ways. We make managing these expenses so easy. We have secure chat. They can call our member services team, make a payment right over the phone. There's no extra fees for that. And we have a wonderful portal, member portal out there where our members can go. They can set up recurring payments. They can see the latest provider directory always in that member portal. They can order new ID cards. They can snap a picture of the ID card, mark it as favorite on their phone, so they're always carrying it with them. So again, the stories, we really love to tell the HealthBridge story through our members' story. So here's one. It was so fun to listen to her voice as she was saying, oh my gosh, I just made my first payment with HealthBridge. It was really cool. It was so easy. I did it in under 2 minutes. And the best part, I saved $45 with my quick pay discount. Fun to get those stories, and we get them every day. Here's another one, you know, a member that loves that she can make payment and she can see everything in that member portal, all the household medical out-of-pocket expenses in one place. And in this instance, she has an HSA. So we all know that HSA plans give that triple tax advantage. Now we're adding a 10%. Your money will go 10% further because of that 10% discount. So wonderful testimonies that we have of our current members. So how about employers? Well, there are many different ways that employers are utilizing the HealthBridge benefit when they design their plan. This here is an example of a self-funded employer with us in their first year. They have over 2,000 employees. 1,400 of those employees use their benefit. And in that first year, we extended over $1.32 million in medical claims. So not only were members using it, but we saved those members nearly $62,000 on that 10% discount. Now, some of you may be thinking 10% discount, that is so minimal. But remember, we're only talking about patient liability. You have that health insurance benefit. The largest benefit is already taken care of through the carrier. This is only out-of-pocket costs to our members. But what's really great about this one, because they're self-funded and they really wanted to steer their care to a high-value health system, the employer saved $3.2 million in that first year on claims costs alone. So everybody is benefiting. There are other employers who are using it. When we talk about an HSA, they've got a traditional plan and an HSA plan, and they say, you know, we really want to get more of our folks in that HSA. Here's another way that can incent those employees because of the financial security benefit. It's really removing barriers and taking that total equation of that deductible and out of pocket out of the conversation for our members. And I know because I am a HealthBridge member and I have an HSA. So let's talk a little bit about how to get started with HealthBridge. Today, you can see that we have partnerships in place. We've been working on these partnerships and we'll continue adding more as we go along. Again, we talk about the health plans. It can be an HSA, an HMO, an HRA, self-funded or fully insured. We'll work with all. Today, we have partnerships with carriers. So Blue Cross Blue Shield of Michigan, Blue Care Network, ASR, ABS, Insight Benefit Administrators, VeraPro. We work with many partners out there. And if you're working with a TPA that's not listed here today, make sure that you reach out to Nulty because we're happy to have these conversations with other carriers and TPAs out there who might want to be a part of this plan. But we'll continue to grow this partnership list. Rollout is really simple. with HealthBridge. It really starts with a contract, an agreement. We get a data sharing agreement with that. And that's what we send to the carrier or the third-party administrator that tells them, hey, Blue Care Network, I want HealthBridge to administer their program for me. So I need you to send them weekly eligibility and claims, out-of-pocket claims information. And the reason we do this is because we don't want this to be a heavy lift for HR. There's no additional steps that HR has to take to administer this program, no enrollment forms to collect. Whenever you identify with your carrier that you have a new hire or somebody that's terminating, you make that notification to the carrier. That's all you need to do. We'll take it from here because of the partnerships that we have with those folks. Really, the biggest thing here is that we need to develop how we're going to communicate with your employees and members. So is it going to be live meetings? Is it going to be virtual? Do you want a pre-recorded session and then do live Q&A? Do you have an intranet that we can post information to? Lots of different ways. Do you need different language outside of English? We'll help you with that. But you and your Nulty agent know your population the best. And so we're going to sit down at a 20-minute kickoff meeting and talk about those things. I want to back up because I skipped right over this. Because we are a new benefit in the market, and you won't find any other company out there like HealthBridge where all boats rise in the healthcare stakeholders. There's no cost to you for 24 months. This allows us to bring you this benefit. We're going to share annual reporting with you and your Nulty agent, and so that you can see the value of this product. And then in the 25th month, we'll talk about a very low cost. Today, it's $1.50 per employee per month to administer this program. But we'll talk about that. Leslie will provide that reporting and have that conversation with you on an annual basis. So there's no setup for you at all with the carrier or with your third-party administrator. After you sign that agreement, we take all of the onboarding and implementation on the back end. And then we're going to support you. All of our members will receive a welcome letter in the mail with their ID card. And we also request contact information so that we can send a welcome email that gives instructions on how they can set up their member portal. We have member services team that have extended customer service hours, and they're located, most of them are right here in Grand Rapids, Michigan, but in the US. Let's hear another testimonial.
Hi, my name is Chelsea McMullen. I'm coming to you from Bronson Healthcare Group. I'm the HR Benefits Supervisor. And I just wanted to hop on real quick and tell you a little bit about our experiences so far with HealthBridge. We went live with HealthBridge on 1/1/2022 for over 6,000 employees and 15,000 members that use our medical plan and the HealthBridge benefit. And it has been a seamless process. The implementation was really smooth. A lot of the heavy lifting was definitely done from the HealthBridge side. They have created custom communication for our organization, offered 26 live webinars, and they're still answering those calls and emails daily and are quick to respond from both an admin and employee side. So we're very thankful for that. Since we've gone live with the HealthBridge, they have already paid over $600,000 in claims for our employees. That is impactful, and over $2,000 of that is just savings because our employees had paid off that remaining balance to receive that 10% discount. So I'm really excited to see how much more savings that they can offer our employees and how impactful it'll be in the future. But I can tell you right now, I'm really impressed, and I'm very thankful for the opportunity to work with them.
And that was such a fun rollout. Leslie and I did 26 webinars, one right after another, 2 days to educate their employees on how to use HealthBridge. So very excited obviously to have the Bronson not only in our network as a provider, but also to have them HealthBridge card carrying members. It's been really so much fun in Kalamazoo in our rollout. So again, just want to let you know, we can customize our program, the ability to create a narrow network. It works in some markets, and in other markets, we talk more about the product line. Is it an HMO? Is it an HSA? That can all vary, and we'll work with you and your Nulty agent to decide how best to set up HealthBridge. We do provide that year-end reporting. It is HIPAA compliant, but for the first time ever, you're going to get insight into how your employees and their family members are handling their out-of-pocket costs. So that can be really enlightening and can help you as you design future benefit changes at your organization. And then, of course, we offer our ongoing support. Leslie's going to stay with you and be there along with our member care team to help when any situations arise. So that's it. Our next steps, really sit down with your Nulty agent and determine how best to introduce HealthBridge to your benefit package. What's really great about HealthBridge is we can be implemented anytime. You don't have to wait for the renewal. If you want to get started today, it's typically a 60-day lead time that our carriers are asking for. And so we can work with you to get a 5/1 implementation if that's what you'd like to do. Other employers are looking at changes that they're going to have to make due to costs, and they know that that's going to impact the out-of-pocket structure, benefit structure for their employees. So they want to mitigate that. So put HealthBridge in early, and so that when you make those changes, it really lessens the blow there. And then strategize for employee education and communication. That's really our biggest next step to see how this is going to be received by your employees. What's the most effective way to educate? And our goal is to stay in there, work with you to communicate this benefit on a quarterly basis. Just a reminder, we all know that once we have benefits, unless we use them right away, we forget why we have that card in our wallet. So we always like to work with you throughout the year to remind our members. So getting started is easy, and we want to make sure that you're providing this benefit so your employees are healthier, they're happier, they're less stressed out, they can focus more on the work at hand with you, and to attract those new employees who are looking for an employer that really cares about them financially. I think we have some questions in the chat.
And there's some really good questions. I think we have plenty of time. So Leslie, if you could unmute yourself and go through the Q&A in the chat, there's some really, really great questions that I think everybody would appreciate the answers to.
Perfect.
All right. And then also, Dean, if you can unmute yourself too, because you can jump in and build on some of the answers. So we got a lot of questions about whether or not we have providers outside of the state of Michigan. And at this time, we do not. However, I do want to let you know that we are in initial conversations with providers outside of the state, and we do see that we will be expanding nationally in the future.
One thing I would add to that, we do have several employers that have employees located in Michigan and outside of Michigan. So typically in those cases, we are doing the Michigan only employees at this time. But what that will do is help us decide and prioritize where we need to grow out of state in the future.
Mm-hmm. I think Borges is always the big question for employers in Kalamazoo is, why is Ascension Borges not participating, and is this an issue? I can tell you from my personal experience, being in meetings with Val and Leslie, they handle that question very, very well. Your employees do not have to switch to Bronson docs. It's not a forced thing. This is a voluntary program. I think that's the biggest thing. And so if they want to continue doctoring at Borges Ascension, not a problem at all. But if they do happen to go to a Bronson provider, then they will get HealthBridge. So again, we don't want to dictate where they're going to go. It's just that Bronson Ascension is just a huge national organization. And so it takes a lot to move the needle to get them to participate in something like this. So at some point they might, but I would not let that deter you. It's just something that, because Bronson was willing to jump on sooner, that's a great benefit. So I would not offer this benefit for that reason. They explain it very well and make employees feel very comfortable when they're doing those meetings.
Yeah, you did a great job answering that, Susan. Dean, is there anything you want to add to that?
Well, Susan answered it well. I would say that we have been working with Ascension, believe it or not, in outside of the state of Michigan. So as you all know, they have a broad reach across the country. So we've had conversations with Borges, but as Susan said, Bronson was ready to roll, and so we went with Bronson. And so it's very similar to Spectrum. There's some questions about Spectrum. We have had numerous conversations with Spectrum. We're trying to grow our network exponentially. So obviously Spectrum would be great to have. They've had a few minor changes there, especially with their relationship with Beaumont over the last year or so. And we've had conversations with Beaumont as well. But right now we don't have Spectrum. But again, most of the networks in Michigan, we've either had conversations or in the midst of working with them in some shape or form towards looking at them coming within the network. So.
One of the things I'd like to add to that is really exciting is that members themselves are helping to drive the expansion of our network, our provider network. And because we had some members go to their provider and showed them their HealthBridge card, and they said, "Oh, we're not a HealthBridge provider." And they said, "Yeah, but I want this benefit. I want you to have HealthBridge." And we just recently added 3 behavioral health specialists because of that. And that was driven solely by the members saying they want this benefit. And you know, we know right now that having behavioral health specialists is so important to employee wellness and retention. And so that's really exciting. And I see that we'll, continue to do that as we see that need. And that's also another way that we just, add extra value and help you retain, help employers retain employees.
What else do we have there, Leslie?
Can I just step in too? I wanted to expand on what Susan said, because when we're offering HealthBridge and a person decides, yes, I doctor at Bronson or at Borges, but you never know. We've had members that have said, you know what, I typically go to Spectrum, but my surgeon can also do my surgery at Metro or at Mercy. And since I have the HealthBridge benefit, it puts choice in the member's hands. We all have different household expenses, and life happens differently for all of us. So what's really great is that you are giving that choice to the member at the time that they hear, "Oh, I need a surgery." So don't let that deter you.
We had another question about how we get paid. If there are no fees to enroll and there are no interest charged to participants, how do you get paid and make money? So what we do is we go to a provider and we talk to them about what they're currently collecting And we have, because of our incredible consumer-friendly terms and the treatment and the engagement that we have with our members, we do have a better collection rate than providers do. And so we end up earning our money through any overages. But then at the end of that, we also provide a revenue share. So if we did collect more than the provider historically collected at the end of that year, we will share that overage with them. The other thing too is eventually when the group is paying that per member fee, it's very reasonable fee to pay. That is another way, but typically it's going to be in how we end up doing our collections, which is very friendly. And again, there's no credit application, there's no interest, and it's just a much nicer experience because really those employers are our customers. And so as an extension, their members are our customers. And you already heard the great customer service that we provide at HealthBridge. And so we'll just continue to provide that to any other groups and employers that we bring on.
And Leslie, thank you for that, because I think that was always the big question that when we first learned about HealthBridge, and I said when we opened it, it almost seems like it's too good to be true, right? But when I talked about the win-win-win, the win is for the hospitals because they're getting their money up front from HealthBridge. So HealthBridge is paying that bill up front, where in other cases, that bill may have to be written off and non-collectible. And so the hospitals are happy because they're getting their money up front. The employees are happy too because they have 24 months to pay interest-free. And then the employers are happy for two reasons. One, they're offering a great benefit, a new benefit at no cost to you and to the employee, but also you don't have to worry about garnishments. And we all know our employees who have these outstanding bills, sometimes they just don't have the money to pay them. And so then you, as the HR benefit payroll people, have to deal with garnishments. And so that's truly, I honestly can say that we understand now how it works. But at the beginning, it may be a lot like you start questioning it, but it truly is a wonderful benefit.
Another question that we had is, can participants who terminate employment and move to COBRA continue with this service? So how we get our information is through the carrier feed. And if an employee has termed, then we would not pay for any new claims. But any of those existing claims that they had while they were an employee with an employer, we will continue to work with them to make those payments and to, finally pay off that claim.
As you're looking through the questions, there is another thing that I wanted to talk a little bit about, because to piggyback on Susan's, this is too good to be true. We actually had an employer in Lansing who titled the webinar, "This is not too good to be true, believe me." And so it really was a great setup for us to go in and do more education. But we do have some employers that go, "Oh my gosh, we don't need it. Our deductible is only $250. Our people can pay." And, speaking to the HR professionals on the phone, you see those garnishments. And in the beginning, we started HealthBridge only covering the deductible and co-insurance. We didn't even cover copays because we kind of thought the same thing. $20 copay, people can afford that. Do you know they can't? And again, we hear these stories in the informational meetings. People come up to us and say, "My gosh, you were just helping me manage this in a way that is so much easier and creates so much less stress for me. I so appreciate that." And so we have municipalities that are on board with us that we thought, that's going to be kind of a tough market because they typically have lower out-of-pocket. Not true. And don't forget, it's not only about that out-of-pocket and having time to pay, but for those that do have the money, they got a 10% discount. So you're saving your employees. I don't care if you make over 100,000 or under 100,000. you like savings and saving money, and this is another way that you can do that.
Do you have any other ones that we want to talk about over?
Most of the questions had been about if we were outside of the state of Michigan. So I think we've addressed that right now. And then the other ones pretty much were addressed as well.
Okay. All right. Well, we will wrap up here. We didn't keep you for the whole hour, so that was great. Just want to let you know some things that are coming up with Nulty that I think all of you will hopefully just really benefit from. Carrie and I both do HR benefit consulting with our clients and prospects. And the question that we have been getting lately, probably in the last 6 months, is what are employers doing with their paid leave programs? Obviously, our world has changed and we have a lot more people working remotely. Flex time is very popular, et cetera. So HR professionals are reevaluating their paid leave programs. Do we need to go to unlimited so we don't even have to track it anymore? Wouldn't that be wonderful? Do we cut back on some things? Do we add benefits like parental leave? So that we're getting so inundated with questions. And if you've done any research on this on your own lately, there's not a lot of surveys out there. The latest ones that we saw were in 2019. There was 2 of them out there, SHRM and one other one. I'm missing the name right now, but those were the last 2 that we could find that really were relevant. So Carrie and I sat down a couple of weeks ago and we wrote out a whole bunch of survey questions. And so we are just actually re-swizzling those questions, I will say, and coming up with a survey for you for the greater Kalamazoo, St. Joe, West Michigan area. And we would absolutely love that you guys participate in it. And then we will be sharing those results. So watch for that coming out probably in the next couple of weeks. The other thing that we are super excited about, and we have been working on this for, I want to say 8 years. On March 16th, we are hosting a seminar down at Southwest Michigan's first new Catalyst Center. And if you have not been there, it is fabulous. And we are inviting employers, and a lot of you may have received the invite yesterday via email. Employers who are 100 employees plus is who we are inviting to this webinar, or excuse me, to the seminar. It's in person. It's in person. And what it has to do with is Marathon Health is our partner of choice for an employee-centered health center. So basically, it is going to be right across the street from our office. Marathon is leasing space there. The office is being built right now as we speak. So as you're driving by on Stadium Drive across from our office, you can say, now I know it's being built there. But the health center, which is going to be considered a network health center for area employers to send their employees there if they want, again, it's by choice, to get primary care, to wellness visits, etc. It's going to be a place where people, we all know that we have a need in our area. Primary care is an issue that it's hard to find primary care right now. And sometimes it's a wait for 3 to 4 months to get in. For those who maybe need a new primary care person, but it's by choice. Again, you don't have to leave your primary care, but you have this facility to go to and hopefully spend more time with a doctor. The appointments are about 20 to 30 minutes a piece. They're going to do a lot of wellness type things. There is going to be telehealth available as well. We're thinking about maybe occupational health too, but we're working with our partners in the area. Bronson is aware of this. We're working with Borges because it's very important that we collaborate with the hospitals, because we will be sending those patients to the specialty areas there. So it's super important that we have collaboration with Bronson and Borges, and we invite those employers that have 100 employees or right around there. Again, you should have received an invite. If you did not receive one, let us know. We will be out on the street dropping these invites too. But March 16th from 8:30 to 10 at the Catalyst Center in the new Southwest Michigan First building. So love to have you there and love to share this experience with you as well. So we will be, Val, what are we going to be sending out? Are we going to send the whole presentation out? I know it's really big because it has videos, so I wasn't sure if we're going to send the link or we can just, I know we have a flyer that we will send to everybody too. So
Yes, and we can send the link from Adam. Your
Okay.
team has been so amazing. Really appreciate that, Susan. So we'll send that out, and then we've got a one pager that I think your team is intending to send out with it.
We will do that. So if you have any questions on this great new benefit, just let us know. We're here to answer those questions, especially if you've heard this for the first time. So everybody stay warm today and have a great rest of your week. Take care.
Thank you.